Ladies and gentlemen, we will begin in 30 seconds.
Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,597 new cases of COVID-19. This brings our statewide total to 10,017 Pennsylvanians who have tested positive now in 64 counties in Pennsylvania. Approximately 1,004 have been hospitalized since our first case was announced on March 6th, and that continues to be approximately 10% of patients. 276 of those hospitalized have required intensive care, and 170 of those hospitalized have required the use of a ventilator or breathing machine. Approximately 489 of the total cases are in healthcare workers. And approximately 14% of our 695 licensed nursing facilities have at least one case of COVID-19. Tragically, we have now had 136 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. Prior to the COVID-19 pandemic, it was actually the opioid crisis, which was the biggest public health crisis that we were seeing in Pennsylvania and throughout the nation. And while our efforts are focused now on this pandemic of COVID-19, the opioid epidemic and the substance abuse epidemic have not gone away. It is critical that Pennsylvanians know that even in these challenging times, help is available. Drug and alcohol treatment providers are open and available during this very trying time and continue to accept patients suffering from substance use disorder. If someone in your life has an opioid use disorder, please keep naloxone at hand, the life-saving medicine naloxone. If you need naloxone, I signed actually a standing order for the public to obtain this life-saving medication from your local pharmacy based upon my prescription as the state health official. For Pennsylvanians in recovery, we know that this can be an especially difficult time for you. Please stay in touch with your peers and your treatment providers and continue to put your recovery first. Many support meetings, such as AA or NA, are continuing to meet virtually. And if your meeting can only get together in person, please make sure that you are practicing social distancing. And now, please make sure that you're wearing a mask. Treatment for substance use disorder is considered a life-sustaining activity, an essential activity that you need to continue to receive. The Department of Drug and Alcohol Programs has a list of resources for individuals and family members on their website at ddap.pa.gov. Again, ddap.pa.gov. And if you or a loved one are in need of substance use disorder treatment or resources, please call Pennsylvania's Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. This hotline is staffed by trained professionals who will stay on the phone with you or your loved one until help can be found and you are connected to treatment providers. Even during these unprecedented times, let us never forget that treatment works and recovery is possible. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as we all know now, the time it takes to sing happy birthday twice. And use hand sanitizer if soap and water are not available. Please cover your coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. The mask that we have recommended should help that. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the dangerous virus, COVID-19. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from Penn Live. Will the department consider releasing the case and death information by hospital?
Not at this time. We are releasing the case counts and the death counts by county.
Thank you. We have a few questions from WNEP TV. Pennsylvania has now seen more than 100 people die from COVID-19. A viewer asks what the breakdown is between men and women. Is the virus more deadly for men or for women?
I don't have that specific breakdown at my fingertips. I know that in general, men are slightly more impacted by COVID-19 than women.
And as a follow-up to that, COVID-19 can lead to death in people who already have underlying medical issues. Is COVID-19 of particularly high risk for people who have diabetes? If so, why?
Yes. So diabetes is one of the conditions that would predispose someone to getting COVID-19, one of the chronic medical conditions that we have been discussing, and potentially to have a more serious case of COVID-19. Besides it being a chronic medical condition, it's not exactly known why diabetes would impact a person to make them more susceptible, but over time, I'm sure we will learn that information.
We have a few questions about social distancing and masks. First from WNEP TV. Now that the guidance is for everyone in PA to wear masks when out in public, viewers want to know what is the best way to clean them after wearing them. Will putting a mask in the microwave kill germs?
Well, we don't recommend putting the masks in microwaves. Microwaves can be challenging for cotton masks, and some of the masks have like a metal nose tip, and that would be very dangerous in a microwave. Really, we recommend that you wash the masks with soap and water.
Very good. This is from KYW News Radio. How well are Pennsylvanians following social distancing guidelines according to the newest data that you have? Do you foresee the guidelines tightening? As more people become infected, is it still safe to go outside for exercise?
So I don't think we have recent data from the time that the governor issued the statewide stay-at-home order, but we'll be looking for that. Overall, the governor and I feel that Pennsylvanians will do the right thing, and the right thing is to practice social distancing, and the right thing is for people to stay home unless an activity is life-sustaining, such as getting food and getting medicine. It is okay to go outside and exercise if you're doing that in a solitary way. So if you're going out for a walk by yourself, then that is fine, or a run or a bike ride. If you are doing that with a gathering of people, then that would not be correct, because then you're potentially going to expose each other to the dangerous virus COVID-19. In terms of other actions, there are no other actions planned at this time. We have made a statewide social distancing order. The schools are closed. Non-life-sustaining essential businesses are closed. And now we have the new mask order if someone is going outside. And so we're going to depend upon Pennsylvanians to do the right thing for themselves, for their family, for their community, and for our Commonwealth.
We have another question on masks from the Altoona Mirror. Are masks for the public primarily meant to keep us from shedding virus material onto surfaces, as in grocery stores where others' hands could pick it up?
Well, yes. So the masks are designed for people who might not have significant symptoms but might be shedding virus, to avoid shedding virus to surfaces if they may cough or sneeze on them, or in terms of aerosolization of the droplets if someone coughs and sneezes. So again, my mask protects you, your mask protects me.
We have a question from Scranton Sentinel. There are concerns about whether or not those infected with COVID-19 are adhering to self-quarantine orders. Could you explain what the state and municipal health departments are doing to ensure that those who have tested positive are remaining isolated at home? Or are hospitals not reporting who has been released to their homes that have tested positive?
So we are not getting reports from the hospital about who they release, but there are criteria for how long those people need to be isolated. And every indication is that people are following those orders. So to repeat, if you have tested positive for COVID-19, you are in isolation. If you are not having significant symptoms, then you might be isolated at home. If you are very ill and require medical attention, you would be isolated in a hospital. Contacts of those who are positive would then be quarantined. There are statistics from the experience of health departments from the Ebola issue that was confronted in 2014, and well over 95% of people do follow those isolation and quarantine orders. And so again, we are relying upon Pennsylvanians to do the right thing and to protect themselves, their family, and their community.
This is from PBS 39. We're seeing stress on the healthcare system in the Philadelphia, Lehigh Valley, Hazleton, and Harrisburg areas. Is the health department tracking the state's ICUs, such as how much of them are in use right now and what capacity is left? How many COVID-19 patients in Pennsylvania are on ventilators at this time?
So we are tracking that data. I actually gave you some of that data at the beginning of the press conference. We're tracking it very carefully, and we're tracking it both over time and day by day. So that is information that we're tracking throughout the state, that we're tracking on a county and a community level. And again, I am in contact with many of the county municipal health department directors. I spoke with Dr. Farley from Philadelphia and Dr. Bogan from Allegheny County today, and we're making sure that we know the situation in each community.
This is from Pittsburgh Business Times. Dr. Levine, you spoke yesterday of having a call today with the University of Pittsburgh analytics team. Can you tell us how that meeting went and what you learned from it?
Sure. So we had a great call with Dr. Roberts from the University of Pittsburgh School of Public Health, with many of our staff, our epidemiologists and our public health preparedness staff, as well as myself, Director Padfield from PEMA, the governor's office, and discussed the methods that they are using with their excellent prediction model, and then also some of the assumptions and variables, the parameters that they put into that. And we'll be looking forward to more data by the beginning of next week.
We have a question from CBS 21 about supplies. The governor of New York says the state is getting ventilators from Oregon. Is PA thinking of doing something similar? And if so, is Pennsylvania bidding against other states for PPE, and can you describe what that process is looking like?
Well, the state is doing everything we can to make sure that we are fully supplied with personal protective equipment such as the N95 masks, but other things such as gowns and gloves, as well as ventilators to supply our hospitals with the resources that they need to take care of COVID-19 patients. So we have received resources from the federal government and the national stockpile, and then we have pushed those out to the hospitals and health systems, as well as PPE to nursing homes and other long-term care living facilities. We have stores of ventilators, and we have purchased ventilators that should be arriving in April to resource our hospitals when they need it. I guess in some ways, if we're purchasing on the open market ventilators and things, I don't know if we're in direct competition with other states, but I guess they might be looking to purchase them as well. We have not reached out to other states for their supplies at this time, but I guess if necessary, we might do that. I want to emphasize that right now, we have adequate capacity in our system. We have enough beds. We have enough ICU beds. We have enough ventilators. We have enough personal protective equipment for our hospitals. And we are continually pushing out more of that equipment to hospitals as they need it, and then getting in supplies. But we want to anticipate and prepare for is the surge, that rise of new cases that could occur over the next number of weeks or month, and to make sure we have adequate resources for that time. And so that's what we're preparing for. But that brings up one of the most important points. The key is to limit that surge as much as possible. And the most important way to do that is through the social distancing initiatives that the governor has put in place. That includes the school closure. That includes the closure of non-essential life-sustaining businesses, and now the stay-at-home order for the entire state. And if, as the governor has said, if Pennsylvanians do the right thing and stay at home, then that surge will be manageable, and we'll be able to, our health systems will be able to deal with that. If we do not practice social distancing, then the surge could potentially be overwhelming to any health system. So in a lot of ways, it's up to you.
In talking about the surge, we have several questions about that and the peak of cases. First, from the Bucks County Courier-Time. Today's total is an approximately 18% increase over yesterday's reported increase in new cases. The percentage change day over day since March 31st has been between 20% and 18%. Are we seeing a trend of the virus slowing down?
Unfortunately, there is no evidence that the virus is slowing down. All the models that we have show continued growth of new cases in Pennsylvania, particularly in the southeast and particularly in the northeast, but other areas too. The day-by-day changes are really dependent on a number of different factors, and a lot of that depends upon the laboratories that are reporting into the system, into our data system that we collect in a day. So very small variations don't mean much. It's going to be trends over time. And when we look at 3-day averages and 7-day averages over time, it's going up. And so we need to be prepared for that surge over time, and then we need to mitigate and prevent the surge from becoming overwhelming by practicing social distancing, and please stay home.
KYW News Radio would like to know, when do you expect the peak of the pandemic to occur in Pennsylvania and Philadelphia?
So I can't tell you exactly when that's going to be. As Dr. Fauci, the director of infectious diseases at the NIH, has said, the virus determines the timetable. We don't determine the timetable or the timeline. Again, we've been looking at various models. I'll be looking forward to the new University of Pittsburgh School of Public Health model next week. There's a University of Washington model that indicates it's in the middle of April. But we will see. But we're going to be tracking it every day. We'll be looking at our modeling, and we're going to work to be prepared.
WJAC-TV would like to know if there are any further measures the state is considering if it becomes apparent the previous measures aren't working as well as you would have hoped. And are you worried people will get restless and ignore the stay-at-home order, especially considering the social distancing scoreboard now gives PA a C grade? So
that C grade on that scoreboard for social distancing was before the governor put in the entire state stay-at-home order. So we'll see what that scoreboard says. But more important than a scoreboard is what everybody does now. And so, again, the governor and I are calling upon everybody to do the right thing and to please stay home to protect the Commonwealth.
KYW News Radio has another question. What are other pandemic measures you would like the federal government to take to help ease the burden on Pennsylvania?
Well, I think it'll be important for the federal government to continue to push out through the federal stockpile the personal protective equipment and ventilators that states will need. And so we work with FEMA, we work with Health and Human Services, we work with the CDC and the FDA to get the equipment that we need, to get the reagents and the testing materials that we need to continue the laboratory testing, and we will look forward to that continued cooperation.
Another question about federal government response from Pennsylvania Capitol Star. The White House seems to have taken the posture that the states are largely on their own. Is that your interpretation of it? And how frustrating is that, given the magnitude of the challenge that Pennsylvania and other states are now facing?
Well, I don't really think it's upon me to comment upon the White House response. I know that under the governor's leadership, Pennsylvania is doing absolutely everything we can to help mitigate the spread of COVID-19, to do laboratory testing for COVID-19, and to prepare the healthcare community and make sure it has the resources that we need. And we will look forward to continuing to collaborate with the federal government to do their part to resource the states for the needs that we have.
Thank you, Dr. Levine. That's all the time we have for questions today. Reporters, if your question was not answered, we will follow up from the Department of Health or Governor's Press Office, and we will return with another briefing on Monday. Thank you.